I'm Dr. Wilbert S. Aronow. I am professor of medicine at New York Medical College, which is located in Valhalla, New York. I was invited by the 19th World Congress on Heart Disease in Boston to give an invited lecture on the topic of 2014 Update Management of Hypertension. During this talk, I discussed various treatment goals by different guidelines and also management of hypertension by antihypertensive drugs. On the basis of randomized clinical trial data, the 2011 American College of Cardiology Foundation American Heart Association guidelines recommended that the blood pressure in patients with hypertension younger than 80 years should be treated to a blood pressure below 140 over 90 millimeters of mercury. These guidelines also recommended, based on the hypertension in the very elderly trial, that the systolic blood pressure in patients aged 80 years and older be reduced to 140 to 145 millimeters of mercury if tolerated. The 2013 European Society of Hypertension guidelines also recommended that the systolic blood pressure in patients younger than 80 years should be reduced to less than 140 over millimeters of mercury. These guidelines recommended for patients with hypertension aged 80 years and older a systolic blood pressure between 140 to 150 millimeters of mercury. Other guidelines published recently that recommend a systolic blood pressure below 140 millimeters of mercury in patients younger than 80 years are from Canada, the United Kingdom, and the American Society of Hypertension, European Society, International Society of Hypertension guidelines. The JNC 8 guidelines were published in 2014. These guidelines recommended that the blood pressure be reduced to less than 140 over 90 millimeters of mercury in patients with hypertension younger than 60 years and in older patients who have either diabetes mellitus or chronic kidney disease. However, these guidelines recommended that in patients aged 60 years and older who did not have diabetes mellitus or chronic kidney disease, that the blood pressure be reduced to less than 150 over 90 millimeters of mercury. I agree with the JNC 8 minority report that the systolic blood pressure in patients aged 60 years and older without diabetes mellitus or chronic kidney disease should be reduced to less than 140 millimeters of mercury. I base this recommendation on data from the Systolic Hypertension in the Elderly program, and these data are also supported by our data from the REGARD study, which will be published in the International Journal of Cardiology. We found in the REGARD study that in patients aged 75 years and older, a systolic blood pressure of 140 millimeters of mercury or higher was associated with an increase in cardiovascular disease, in coronary artery disease, and in stroke. Older persons are the group that is most inadequately treated for hypertension, and they also have the highest incidence of cardiovascular events. I am very much concerned that the higher systolic blood pressure goal recommended by JNC 8 will lead to an increase in cardiovascular events and in mortality in patients who are older than 60 years of age. I finally would like to conclude by saying is that this is an excellent meeting for young people to present their original research. I hope their mentors encourage them to do so.